The Utah General Legislative Session begins January 20th and runs for 45 calendar days. And in that time, a whole bunch of policies are going to get done. 1,000 bills will be filed, 500 or so will pass and become law. And a bunch of those are going to deal with healthcare issues. So we've got Francis Gibson, the president and CEO of the Utah Hospital Association, with us. You ready for this?
Oh, man, this is my favorite time of the season, 100%. Served a long time as a legislator, but on the outside, a little bit looking in. But it is a fun time. Very compact, shortest session in the United States. We get the most done, balanced budget, active legislators, constituencies that they deal with, and they all have an opinion, and both from constituency and themselves as legislators. But it is fast.
It is an intense 45 days, and there's a lot of policy that gets done in that time. And you come out of that with some successes and some things you wish would have maybe gone better. And then you get to see how they play out throughout that, the rest of the year, the other 9 months or so of the year. Looking back onto the session last year and the things you worked on, now as you reflect back on the session in 25, did you feel just as good about it as you did at the end of the session itself?
Oh, we look back and, I think our legislators do a lot with what they've been given in a short amount of time. One of our big successes was the 340B program, for example, and that's just to maintain lower cost of prescription drugs and lower cost of drugs that hospitals purchase. And I think that was a big success. I think the overall funding for hospitals and for Medicaid was a success last year as well. And there were some other bills that went through that maybe weren't as good, but I think overall, healthcare in Utah, we have a good system. And we have some of the cheapest healthcare in the United States compared to others. But that being said, it's still expensive. And there are always ways to continue to improve our costs, but it does take funding. And so I think overall last year was a good year.
Looking ahead then to 2026, what's on your radar? What are you saying? These are the top couple of priorities we have heading into the year.
We recently just had the big, beautiful bill that was signed in Congress that are going to be cutting Medicaid over the next few years. And so I think as we move forward looking into this year, we need to minimize the amount of state cuts we have, because we already know going to this year, we're going to have close to a $200 million cut in hospital funding from the feds going into this year. And so it's going to take a very interesting and creative way to fund the way we do in practice medicine. And now a lot of people have private insurance, and I think insurance rates will continue to go up. I know that as we looked at the tax appropriation bills that we're going through, looking at private insurance and helping people to be able to offset some of their premium costs, that went away. And so how does that affect private insurance and how people deal? I'm sure that there'll be some people that will get off of private insurance. Will they be uninsured? Will they shift to Medicaid? I don't know what that's going to look like. But we do anticipate an increase in the amount of uninsured or unfunded people coming to the hospital seeking care, and how that will be funded and taken care of yet to be seen. So I think those are things that we're going to look at. I think there are also going to be other bills that we don't know that are out there, and what do those look like, and how we would deal with those, and so we'll see.
One part of the whole supply and demand issue with healthcare is making sure we have enough healthcare workers. Workforce development for nurses, doctors, everywhere along that medical spectrum has always been an important thing. It's becoming more and more important. What do you think the legislature can do, or what are you looking at during the legislative session, or how we make sure we're training the right people for the workforce?
Great question. For years we've said we had a nursing shortage. I think we're starting to see more nurses than we have jobs, or at least in traditional hospitals. I know nursing homes, as we look at people age, the nursing homes, they still need nurses. And are we going to see more nurses, new nurses willing to shift to geriatric care to potentially fill some of those? Some of our biggest hospital systems now are looking at how do we streamline costs, and what does it look like from a ratio, nurse ratio to patient ratio. And so nurses, that demand is maybe cooled just a touch, but what hasn't cooled just a touch are our phlebotomists, our x-ray techs, our other things that we need to make hospitals run. Those type jobs to continue to be in need. On a physician standpoint, looking at when you talk about where do physicians do residency programs, 80% of physicians stay where they do their residency training, not medical school, but where am I doing my residency training? So I want to be an ER doc, I want to be an anesthesiologist, I want to be a radiologist, I want to be a family practice, health, family medicine. where I do that residency training, there's a high correlation of those folks who stay. And so in the past, we've seen the legislature help fund a little bit more residency training funding for our medical school students who want to train here. You know, currently we have 3 medical schools. We have 2 DO schools. We have the University of Utah. And then we have BYU going to open up a medical school soon coming up. And so creating more residency spots for physicians to do training, that would be a big year. That will be a big deal as if the legislature will help be able to keep more of those physicians to stay in the state for the residency. They'll stay here and practice.
Seems like every session has 1 or 2 hot topics. Sometimes it's air quality, sometimes it's water. In the last couple of years, it's been mental and behavioral health. What are you watching on that front as far as this session and what needs to get done?
Absolutely. I think there will be several bills that will come out that we don't know about. You know, there is a bill currently that's being discussed just about electric shock therapy, and is that good? Is that bad? Should we ban it? Should we not ban it? I think there'll be some discussion about that particular therapy. I think, though, that we would want to be careful as a legislature to not intervene in a relationship between a physician and a patient and what that looks like, and not overstepping that balance of a physician's relationship and how they deal with patients, and an appropriate, you know, parental guidance. But even as we get adult over the age of 18, 19, that should be a decision made between a physician and their patient. And I think any bill that would intervene with that, we'd want to be cautious about. But I think overall, when we talk about patients, we talk about mental health, we talk about safety for caregivers and mental health. We have a lot of workforce violence issues that come from patients who are just mentally, they're not themselves. I don't think anyone ever goes to the hospital and says, how can I injure a hospital worker or a caregiver? But that does happen. And I think there needs to be some protections in place for caregivers. And I do know that will come up this session as well.
I want to wrap up on this. You will be on the Hill quite a bit during the session, so will a number of members of the Hospital Association team. How can your members best support the work you do on the Hill to get good healthcare policy in place?
I think every legislature serves in a civic organization, whether it be the Kiwanis Club or Rotary, or they go to a church, whatever faith that may be. I think not everyone goes to church or serves with a hospital executive, but almost everybody works with or lives next door to a nurse or to someone who works within a hospital. And so I think if you work at a hospital and there's a bill that's concerning, let's speak up. Let's talk to your legislative friend that you know serves in the legislature and tell them how this bill will affect them, or maybe how this bill won't affect them. And I do know that we've had some of our legislators react based on what caregivers are saying on a particular issue, whatever it may be. And so I think that's one way to just be involved. Follow Utah Hospital Association on our socials, on our website, as we update you and bring updates from what we're seeing firsthand within committees. Be responsive, maybe make a phone call, maybe send an email, maybe walk next door and say, hey, this is my legislative friend, and whatever that issue may be, lend your voice. You're the ones who work frontline. We will advocate for you. We want to do what's best for hospitals, but more importantly, we want to do what's best for the citizens that we serve. No one wakes up excited to go to the hospital. And as weird as this may seem, we don't want you to go to the hospital. We want to keep you out. We want to keep you healthy. We want you to, skiing or playing baseball or golf or just going to your son or daughter's ball game or granddaughter's soccer game or dance recital. We don't want you in a hospital. But when you come, we want to be able to provide the best care we can. And just as legislators, they want the best health care possible in the state of Utah, we want to be able to see that we provide that. And the Utah Hospital Association works hard to be able to do that.
Francis Gibson is the president and CEO of the Utah Hospital Association. It all starts January 20th, but it's over on March 7th. So let's make it to March 8th, shall we?
Absolutely. Thank you.